And hello again, my name is Dylan Black. Welcome to another edition of Daytime Ottawa right here on Rogers Television. If you suffer from sleep apnea, perhaps you don't even know you suffer from it. Our friends at Yazdani Family Dentistry are about to help you out in a big way. Let's say hello to Dr. Shahrooz Yazdani, the owner of the dentistry. Nice to have you here, Doctor.
Thank you for having me here, Dylan.
Family-owned dentistry. Okay, so tell us a bit of the history on your dentistry.
So basically, I graduated dental school in 1998 from the University of Toronto, and a few years after, about 3 years later, I decided to open up in Kemptville. I purchased an existing dental practice. And so I've been practicing there for about 17 years now.
Okay.
And 2 years ago, we set up a second location in Canada.
So things are good.
Yeah. I've been very fortunate. The community has been very good to me.
That's very good to hear. Okay, so we're talking about sleep apnea.
Yes.
Now, some people don't even know what sleep apnea is all about. So what exactly is it?
So sleep apnea is actually a very serious medical condition that's severely underdiagnosed. And essentially what occurs with sleep apnea is that when you're sleeping at night, your tongue drops and blocks your airway. And sleep apnea is diagnosed as essentially when the airway has been blocked for a certain amount of time, for 20 seconds or more, and if it occurs several times per hour. So just to give you an example, someone that has mild sleep apnea would stop breathing for at least 20 seconds, 5 to 15 times per hour.
Yikes.
Per hour, which is incredible. So someone that has severe would stop over 30 times per hour. And if you think about it over the span of 8 hours, that's about 200 times that you stop breathing for 20 seconds.
That's scary stuff.
It's very scary.
So what is the connection then, sleep apnea and being a dentist?
So essentially, one of the things that I discovered is that sleep apnea is severely underdiagnosed. Only about 20% of people that have sleep apnea have been diagnosed by it. And the main reason is that people aren't aware that they have it. And the current medical system, the way it's set up, is that you essentially go to see your doctor if you have certain symptoms. So sometimes people that have severe sleep apnea, if they have severe fatigue, the doctor may investigate sleep apnea. But a lot of times it's not as severe as that. It's a very sort of low-grade disease. And so the reason that it makes sense for the dentist is that, people often visit the dentist typically twice a year.
Yeah.
And so we have direct access to the mouth and the airway. So we can actually, so there are certain things that we can see in the airway that can reveal that you might be at risk of sleep apnea.
All right, so you brought a contraption.
Yes.
State of the art. What exactly do you have here?
So this is a sleep study device. And essentially one of the things, the only way that we can diagnose sleep apnea is if you do a sleep study. And most people are referred to the hospital where you have to sleep overnight and they have multiple leads on you. And this device allows you to do a sleep study at home. And it's very simple to use. I've actually done it on myself.
Have you? Okay. Do you have sleep apnea? Are you okay?
So I did not think I had sleep apnea because I didn't just have any of the symptoms. But when I did the sleep study, it came out that I do have mild sleep apnea. So I'll be building an appliance for myself. And so I was quite shocked at that. And so it really opened my eyes to the fact that you may not think you have it, but a lot of people do.
Okay, so let's see how it works.
Sure. Essentially what it does is it goes right on the head, and there's a sensor on the inside here that picks up all the information from the bloodstream in terms of the blood oxygen, the pulse rate, and then right here, the nasal cannula fits right into the nose, and that also measures the breathing.
Okay.
So through this device, essentially, you would wear it overnight. You take it home with you. We would have it set up. You would wear it overnight, and you bring it back to us. We connect it to the computer, upload the data, and the data is assessed by a technician and then reviewed by a medical doctor who will determine if you have sleep apnea. And I should emphasize that there's only one way that you can know if you have sleep apnea or not, and it is through a sleep study. We may suspect sleep apnea, but until this is done, we don't know if you do have it or not.
Okay, so how accurate is this device?
So the home devices have actually been determined to be highly accurate. So there's been questions as to whether compared to the sleep studies that have multiple leads, whether the accuracy is high enough. And actually, what they've found is that the accuracy rate is extremely high. The issue is that they do cost quite a bit. So a lot of places won't invest in it.
Okay.
And also there is a cost. So if patients of ours would like to have this done instead of going to a sleep clinic, there is a material cost as well as a physician cost of about $300.
Okay.
And so some people would prefer not to do that, and that's totally okay. In those kind of circumstances, if we suspect sleep apnea, we essentially recommend that they see their medical doctor for a referral to a sleep clinic, in which case it would be covered by OHIP.
Okay, so you mentioned that you diagnosed yourself. So the next step is you, at a dentistry office, a dentist will actually build a device?
So essentially, there's two ways to treat sleep apnea, two essential ways, main ways. One is the CPAP machine, which many people are familiar with. And the CPAP is actually the gold standard. It's the most effective way to treat sleep apnea. However, the compliance rate of CPAPs is about 25%. So what we've found is that some patients just refuse to wear it,
okay,
or they stop wearing it, or they'll wear it, for a certain period of time, and then they essentially drop it completely, so they're not being treated.
Okay.
So the sleep appliance is a way to treat the sleep apnea, even though it may not be 100% as effective, although with moderate and mild cases, it is equally effective.
Okay.
But with the severe cases, we still recommend trying the CPAP, but if that fails, then we move to the appliance.
I know we only have about 30 seconds left. Of course,
Sure.
you do good stuff at the dentistry office, dentist-wise.
Right.
Free programs.
Yeah, so we do a free smile giveaway every year for someone that would like a new smile, and we also do a free day of dentistry in each of our clinics every year. We just had one this past weekend, and we gave away about $30,000 of free.
That's incredible.
Treatment.
Doing good things in the community.
Thank you.
Helping people with good teeth and breathe right. And okay, so your two locations one more time?
One in Canada and the other one in Kempville.
Okay.
Yeah.
So was that more details, of course, at yazdanidental.ca. And I'm glad you didn't have to strap that to my head. I don't think we have a big enough one for this, but that's a whole
It is
other story.
adjustable.
Much more coming up, including details on Halloween psychic and craft fair for a good cause next on Rogers TV.